Hello everyone. So today we'll be talking about Atlas. This is the first cervical vertebra. It has no body. It has no spine. So it is a atypical vertebra. It has two arches, anterior and posterior arch, and two lateral masses. It is called Atlas because it supports the globe of the head, and it supports free nodding movement of the head, and due to the absence of the spine in the Atlas vertebra. Now coming to the lateral masses, they lie obliquely between the two arches, and it is connected by each other by in the front by the short anterior arch and behind by the long posterior arch. So in the superior surface you will see there are superior articular facets. They face upwards and medially, and they are concave and elongated, and they are somewhat kidney shaped. The margins of the articular facets give attachment to articular capsule of atlanto-occipital joints. And coming to the inferior surface, you will find similar but a bit smaller articular surfaces or facets. Then they face downwards and medially and are slightly backwards, nearly round and slightly concave and flat. They articulate with the superior facets of the axis vertebra to form atlanto-axial joint, one on each side, and the margins give attachment to the articular capsule of the atlanto-axial joint. The medial surface presents a small tubercle which gives attachment to the transverse ligament of Atlas, which passes behind the dens of the axis and helps to retain the dens in position. Now, the anterior arch has a facet posteriorly in which the odontoid process of the axis vertebra articulates. The anterior tubercle, there is an interior tubercle here, you can see this is the anterior tubercle. Anterior tubercle on the anterior aspect of the arch is present in the median plane. Now attachment to the anterior tubercle is anterior longitudinal ligament on the tip and longus cervicis insertion on the side of the tubercle. Now on the upper border supports the anterior atlanto-occipital membrane, and the lower border attaches anterior longitudinal ligament. Now coming to the posterior arch, the upper surface has a wide groove behind the lateral mass, and this one, you can see this is the wide groove, and it lodges the third part of the vertebral artery and the dorsal primary ramus of the first cervical nerve. The groove may be converted into a canal by a spicule of a bone. Sometimes there is a spicule from this side and it will completely cover the canal. Now there is attachment to the posterior tubercle here. The attachments of the posterior tubercle are ligamentum nuchae in the midline, rectus capitis posterior minor on each side, and to the upper border behind the groove the posterior atlanto-occipital membrane, and to the lower border ligamentum fleba. Now coming to the transverse process. The transverse process is quite long and strong as adequate levers of the muscle to rotate the head. Each ends laterally is in a tubercle. There is no costotransverse bar. Now coming to the attachments, on the upper surface it gives origin to the rectus capitis lateralis anteriorly and obliquus capitis superior posteriorly. To the lower border and lateral margin there is origin of levator scapulae, insertion of splenius cervicis, splenius medius. Now on the tip, the inferior oblique on the tip, so this is the axis bone. I hope you like the video. Comment if there is anything left out.